I'm Bruce Mann. I'm a specialist breast surgeon in Melbourne. I'm head of breast surgical research at Royal Melbourne Hospital and director of research for breast cancer trials. I've led my support to the Conquering Breast Cancer documentary over the last 10 years or so. When the idea came from Dinah, the lady whose journey is documented, she was my patient, and she wanted to document it because she believed that her lived experience was vital for others considering the journey and for the clinicians who were supporting women through it. And lived experience changes what we do from something that is like a technical task or an academic exercise to something that really matters, because these are individuals making some of the hardest decisions they've ever made, going through the most difficult times. We need to be acutely aware of that so we can support them as best we can. And I think the documentary highlights those issues extremely well. The disease is getting more common as the population ages, but there is a small increase in the proportion of breast cancers diagnosed in women less than 50. Somewhat worryingly, the participation in breast screen is falling. Since the pandemic, we've never had participation more than about 56%. Most recently, it's only about 52%. That is worrying, because early diagnosis really is the key to better outcomes. Women who've been screening, who are diagnosed, need less treatment, have better outcomes, and overall it's a good thing. It's much better if women are screening.
Hi, I'm Kensi Naicker. I'm the General Manager for Hologic Australia and New Zealand. Hologic's Global Women's Health Index first started in 2020, together with Gallup, surveying over 144 countries, 97% of the world's population, and today we're launching our Year 5 data from 2025, and we're doing that in conjunction with Conquering Breast Cancer, an important Australian documentary about the lived experience on breast cancer and how that compares to data. So Hologic has been involved as a presenting partner for Conquering Breast Cancer because it brings together a group of very important stakeholders, from researchers, clinicians, patients, advocacy groups, and I think industry also represents an important partner at the table to further the use of technology, how we get better health outcomes for women. Whilst this is a screening for Conquering Breast Cancer, the report actually looks at whether women were surveyed for all types of cancers, and it shows that roughly about 23% of Australian women in the last 12 months were checked for any form of cancer. Now that's probably a little low in terms of where we'd like to be. For breast cancer screening, it's about 52%. So it shows an opportunity for people to get tested or to be aware that they need to get tested.
For many people, life is busy and it's something that just slips the mind. Others would prefer not to know, and they think, well, if they don't look for it, they won't have to worry about it, and that's tragic. Some are screening outside of the screening program, and that's where we need to ensure that what is offered through breast screen is as good as possible. And then for some, it's simply access is difficult. That's particularly for those in remote Australia. When asked about barriers, I need to start by saying Breast Screen Australia is an extremely good service. We offer no-cost screening to all women 50 to 74. It's available women 40 to 49. One of the things that has happened recently, we've identified that mammographic density is important. That's the amount of glandular tissue. A woman with high density, a standard screening mammogram is less sensitive for her, and so she's encouraged to seek advice about further supplemental screening. That's screening with things such as MRI or contrast mammogram. Those are limited and they are not provided by Breast Screen Australia and therefore need to be funded by the individual. That will inevitably lead to some inequities in access for those additional technologies.
Some of the call out in the data shows an opportunity to be more aware for preventative screening. That really is the key in terms of cancer screening, is the awareness and the right to get tested. And the follow-up, that's important if you're in a high-risk group.
Yeah, my name is Lynette Bolton. I was diagnosed with triple-negative breast cancer in December of 2025. I was in the shower at the end of November and I found a lump, and about 10 days later, after going through all of the scans, the mammogram, all of the things, I was officially diagnosed with breast cancer, and I started my chemo and my treatment journey on the 19th of December, just before Christmas. But I'm still in treatment. I actually started radiation yesterday. So that's the next thing I'm off to today, and that goes for 3 weeks, and then I have immunotherapy until the end of the year. So a year and 2 days it will be. I think social media is a wonderful opportunity for people to feel connected with others. I also think that clinicians can use it as another way of sharing stories, of sharing stats, of bringing people, to the forefront of what they need to be doing. Unfortunately, I think for women especially, these days we're so busy. Looking after ourselves always falls to the bottom of the list. We're always looking after kids, after partners, working, parents, everything else becomes more important. But it is that old age story of you've got to fill your own tank first. I really do think that women tend to ignore things. We tend to ignore symptoms. It's that whole, it'll go away, I'll feel better in the morning, I've got to look after everybody else.
It's been remarkable, the improvements over the last 20 or 30 years. The amount of treatment we need to give is less. I'm a surgeon. We do far less surgery than we used to at the start of my career. The additional treatment, the radiation and the drugs, the medication are much more effective, which means that the likelihood that a woman diagnosed with breast cancer now is going to die from the disease is far less than it was even 20 years ago, and much, much less than it was 50 years ago. So overall, breast cancer, its treatment is a good news story, but we could do better. I think the Global Women's Health Report is really important. It's very ambitious, it's very broad, and it shows that there's areas where things are improving. But there's certainly a lot more to be done. It is a global report, and a lot of it is relevant to less wealthy countries. We need to be aware of that, and I think from our national policy we should take that into account. What does it mean for Australia? My interest is screening, specifically here is screening, and it is disappointing that our participation rate is still only in the low 50%. We must be able to do better than that.